Your financial advisor may not be the first person you call when you have a question about your health care coverage, but it can be. It actually makes sense because a big part of your retirement plan should factor in the costs of your good health. That is why Cory Sickles has Medicare specialists as part of his team at Safe Harbor Retirement Group. Cory, a great topic for our viewers, especially because this is the time, right, when they're all starting to think about Medicare.
It is the time,
Yeah.
October 15th through December 7th is, the annual enrollment time for anyone out there with Medicare Advantage plans or, or a Medicare plan. So it's always good to, we talk about doing a financial checkup, but, this is something that you really should get a financial, or not a financial, but a healthcare checkup once a year as well.
Now, how big a role would you say healthcare coverage factors when you're talking about financial retirement planning? How big of a part should that play in it?
I would say big part, and here's the reason why. If you don't have a mortgage, your next highest expense is your health care. So you want to make sure that you're always in the best plan because, let's face it, it's going to constantly go up. You're going to have more things happen, whether you're getting a hip replacement or a knee replacement or maybe you have a heart problem. So it's always going to be something that's going to take place the rest of your life.
And so, as you mentioned, open enrollment less than a week away now. How are you going to help your clients? How can you help people prepare?
Well, one of the things our specialists are doing, they're reviewing all the 2020 plans to find some of the differences between the 2019 plans. So they're already starting to meet with some clients, that have already scheduled to come in, so they're going to be ready to go next week. But, it does take time to come in, sit down and work with our specialist. But it's just a good time to review what you have.
And then every year you should review. We kind of, we say that, but it's because I know that we just heard, a doctor may be leaving a plan or somebody's network is no longer in network, and that stuff happens constantly.
It does happen constantly. Maybe you need a new specialist for whatever reason.
Right.
Because you're getting that hip replacement, or maybe you have to go, to a cardiologist. But the one thing you want to be able to do is to find out, to make sure, is that doctor in my plan, even though he was in it last year, is he going to be in it this year? And it's the same thing with prescriptions. You want to make sure that you're getting the lowest cost, because one thing they'll kind of do is move them from one plan to another, through their tiers.
And then costs can obviously change. Situations can change, as you mentioned. So people who are just getting into this whole retirement game that we talk about really do need to assess all of these different aspects, right?
They do. They're projecting. If you compare 2018 versus the 2020 plans, the Medicare Advantage plans are actually going to be about 23% less.
Okay.
So it's very important that, especially if you're retired living on a budget, every dollar can help when we start talking about savings. But, if you're saving, if you're paying $100 a month, now you're looking at almost, a little bit less than $80 a month that you might pay for it. So it's something that you definitely want to be able to do.
And so you have these Medicare specialists. Have you always thought this is something that we want to get to, that we need to help our clients with? Because not everybody does as a financial company. That's
right. One of the things we try to be full service. So, I handle the financial side. We have a tax person, we have a legal, and this makes a lot of sense as healthcare because a lot of people can't retire until they know what type of plan they're going to be on, or what am I doing if I'm not 65? So this fits right in, for our clients. We want our clients to be able to come in, sit down, and it doesn't matter whether it's me or healthcare or legal. You're going to be able to sit down and talk to that specialist. And
if they do talk with that specialist, then on the Medicare side, and they find out maybe it's going to cost them a little more, maybe they have something that's going to be taking more out, and they're on a fixed income a lot of times, right? Well, then you be able to reassess based on each change, kind of what they're looking forward as far as their financial plan.
That's exactly right. One of the things that's why we have annual meetings, to be able to check budgets. Do we need to increase it, decrease it? And of course, healthcare is going to be one of those things, and it's nice if you can save a few dollars because you're going in every year to make sure that you're having the best healthcare deal that's out there.
All right, Cory, are there any added costs to this service?
There's no added cost. Of course, for our clients, there's no added costs. And if you're not a client and you just want us to do a review, there's no cost for that as well.
Okay, and you can always go in. You have 2 locations, right, Cory?
We have one in Dublin and one in Easton. You can just give us a call, 614-760-0670, and we'll review your health plan and come back with a great recommendation for you.
All right, and as you mentioned, October 15th it all gets started, so you got to think about it now.
That's correct.
Not later. So give him a call today. It is Cory with Safe Harbor Retirement. Thank you.
Thank you.